all my esteemed colleagues, all the gracious sisters. I don't know the way I have been described, whether that's a suitable description or not, because love is many faceted. And quite a number of you have faced my love not in the pleasant form. During my irregular visits to the wards, I am quite sure, because bitter experiences are remembered more than pleasant experiences. So maybe I am not that much loved. I of course want to extend love to each and everyone, but that's a different matter. Today is a very auspicious day, and as I have been mentioning always, healthcare, especially a hospital-based healthcare, is totally 99% dependent on the services of you. That is the sisters. The nursing fraternity the world over have, over the years, over centuries I think, proved that their concern, their sympathy, their empathy goes a very long way in giving that care, giving that relief, giving that confidence to the ill and sick people. It would be not out of place to mention, yes, medicines are important, the doctor's clinical acumen is important, investigation reports are important, proper antibiotics, and as the lady who showed us the goals, of course, did not carry out her precautions in saving her throat while working in the dialysis unit. I think she should have taken a little more precaution to save her throat before she spoke. She had mentioned about policies, and let me remind you, this small little hospital of ours has attempted to form an antibiotic policy about 3 years back. Let me ask you, how many of you have seen that booklet in the wards, which was very painstakingly prepared by Dr. Dhanwar, our microbiologist? Attempts have been made, but only when we follow those can we implement a policy. There is a booklet on the antibiotic profile, the infection profile, and the antibiotic profile, which was done based on the cultures and sensitivity reports of all the wards. But unfortunately, since I think it's my opinion that Dr. Dhanwar is not that impressive when she speaks, people have not taken her seriously. If you search, you might get it in your duty room, the table on which all of your bedhead tickets are kept, you do all your work. In those drawers, you might be successful in finding out. Regarding the other protocols that you mentioned, the other disadvantage this hospital has, it has always given, never taken. We've had the topmost urologist in the city, the topmost nephrologist in the city, the topmost gastroenterologist in the city, and one cardiothoracic surgeon in the city who have started in this hospital. We also have a cardiothoracic master degree holder in nursing who has also taken from this hospital and is moving over to give it to our neighbors. So with that way, we really cannot implement policies. Once all of us who specialize, who gain more knowledge from outside, don't share it in the hospital, don't consider this hospital our own. You have to own a hospital to correct it, to improve it. Like it is your homes. You beautify your home, you maintain a certain amount of cleanliness in your home, you maintain discipline in your home because you own your home. It's the same way. Once we start owning this hospital and consider it as our very own, we'll definitely find improvements in the hospital. Coming back to, I have digressed a little, please excuse me for that, it's possibly the age, because I remembered what the speaker had spoken during the goals part. Yes, education is something which you can all help, not only in the hospital, but outside the hospital also. If you can take that thought and feelings and implement it outside. You can start it from your homes also. Because I'm sure all nursing fraternity people, except our male brothers who have joined recently, all of you are compelled to keep somebody to look after your child. Am I wrong? Now those people you are employing to look after your child can be educated. If it's a small child you are employing, even if it's a bigger child you are employing, that is where you can start your attempts at literacy. That is where you can start your attempts at nutrition. While you are looking after the nutrition of your child, if you look after the nutrition of the servant you have kept to look after your child, you will be helping 0.001% of the world population. That is also something which you can do and say that, yes, I have achieved. I must record my appreciation for the entire nursing fraternity of this hospital. We have all the VVIPs of railways coming back to this hospital even after their retirement. I feel proud. In fact, only yesterday there was a meeting with the general manager where there were 3 retired officers. One of them was a retired GM. The other 2 were very senior railway officers who had retired. And they mentioned, and I felt so proud, that even though they have worked in Eastern Railway or even Metro Railway, they preferred to get their treatment in this hospital. They were mentioning there are certain doctors for whom we come back, but I knew why they wanted to come back. It is also the way they are treated by you, the way they are taken care of by you, the way you show your sympathy, your care and your concern, that even people who have not worked in this railway prefer to come back to this small little railway hospital of ours, which is at a garden much beyond reach of the city, although we call it garden reach. But practically, for those of you who are coming and going, the newcomers I mean, are facing that difficulty day in and day out, how to reach the hospital in time and how to go back in time. So even in spite of having hospitals right in the center of the city, even Eastern Railway officers prefer to come to this hospital. It's not only because it's situated at a very picturesque location, it is not only because our doctors are excellent in their work. Some of them are getting pretty bored listening to my boredom. I appreciate their boredom, but then there's no choice. You only get a chance to become a CMD once in a lifetime. Please bear with me, you will get your chance also. So, you really cannot forget the contribution that you do. And while talking about literacy, nutrition, health, discipline, policy, you can make a beginning. You can get in touch with the microbiologist, you can get in touch with the person who is more knowledgeable than us, who has seen a protocol being followed in a multi-speciality corporate hospital, and try to induct those protocols in our hospital. It is not impossible. Your hospital is rich enough to change an IV cannula after 3 days. Your hospital is rich enough to change an IV line even in 24 hours. But someone has to implement them. Someone has to remind in time to procure them. You should not start getting panicky on the day the stock is zero. Like this morning itself, we faced it in the SICU, where everything was out of stock. So let us tighten our belts. Of course, I got another appeal today, and this is the right forum for me to mention that. Lady Florence, I don't know how she would have felt if she was here today, even after 193 years, if she found that the nursing uniform is becoming so modern, we don't want to wear our caps. What does the house say? Should we continue with the caps or we get rid of the caps? But you look after your hair. Where is the commitment and the pledge that all the people who will take off their caps and do duties without a cap will have dandruff-free hair which doesn't fall into the patient's body, will don't have any other things creeping in their hair which will not fall into the incision site? So once you give that pledge, we can do away with caps. But please don't go below the cap. It will be very difficult for us to get rid of the rest. A uniformity, a dignity, everything is in a uniform. Tomorrow if the army comes and says we are not going to wear our berets, our ex-army sisters won't like it. So let us bear with the caps for a little while. You look very smart in the caps, you look very beautiful in the caps, except the brothers. I don't call the brothers beautiful, sorry. So wish you all the best, and let us see, when you celebrate the 200th birthday, if I am alive, please invite me. I'll come as a guest and enjoy the program. I'm sure the arrangements are excellent, and I'm sure it will be a fantabulous program with so many new artists taking part. And I only wish and pray the stage is strong enough to take all that pounding. Wish you all the best.